all the dignitaries on the dais and off the dais. I thank all the organizers for giving me this opportunity to present my talk in front of you. My name is Dr.SRINIVAS PRASAD. I'm a graduate in Ayurveda from Hyderabad. Now I'm working for NIMS Wellness Center. So today we'll know a lot about the Ayurveda, how exactly it has come into our life. Lakshminivas sir has really boosted up a lot. So today we'll look at it. Today we'll talk much about basics of Ayurveda and Ayurvedic for everyone. Ayurveda and its relevance in today's modern science, and then success stories, some of the success stories which I have treated at my clinic, in my dispensary, and common health challenges and their remedies, which we regularly witness in a day-to-day life, and some of the longevity tips, and women's health and the beauty care, which is also a very important thing. As we all know, the Ayurveda belongs to very ancient days, that is some thousands of years back, 5,000 years maybe. Can you imagine what kind of medical facilities used to have in those days? How exactly they were treated for their diseases and all. Most of the diseases which we are witnessing these days now, were not in existence in those days. But still the system has developed a lot of treatment protocols for most of the diseases which are existing now. Cancers were never seen in those days. Even we also, whenever we talk to our grandfathers and grandmothers, they never told us, how cancer used to be. Some rare conditions they used to have, cancers and all. Nowadays, cancer has become a very common phenomena among most of the people. That could be because of our lifestyles. Maybe your daily routine practices and all. What are the causes? There could be many different things which we'll definitely look in this particular program. See, look at this. This is a very important kind of a slide. I just wanted all you to look at it. The present scenario, when you look at it, very few amount of people, those who are propagated with public health practices, or healthy practices, or preventive health practices. Then most of the people are they are, because of lack of practices, public health practices or maybe preventive practices, people are going to primary health care or maybe to the secondary health care, a larger number in tertiary health care. If we can propagate in larger number, maybe preventive health care propagation, automatically number of people attending the primary health care is reduced, attending the secondary care is much reduced, and tertiary care even further reduced. So, which we have to look at that particular area, as Shekhar sir was telling me our vision 2030. So, this should be the practice which we need to adopt. Come on. These are the few things which I wanted to show you. So that was a university where medical practices, medical colleges were run, and that was the situation where a teacher used to sit and most of the disciples were taught with the medicines, and some practicals were conducted among the dead bodies to know the anatomy or most of the scientific things. Next slide, please. These were some of the sculptures, how exactly those medical practices, this was depicting the delivery. It was sculptured almost, some thousands of years back. This particular sculpture seen in the southern India temple. That was the most relevant style of getting delivered. That is squatting system. Nowadays, people are looking to have a practice of this kind of delivery instead of doing in lithotomy position. Nowadays, practices are like, a pregnant lady is made to lie down in a lithotomy position, and then the delivery is being made. In this particular one, that particular pregnant lady is made to squat, and then the delivery is made. Because of the gravitational force, maybe the delivery was very easier. There was no injury to the baby. Next, please. See, most of the people doesn't know that Ayurveda had surgery or surgical practices. You can see the surgical instruments which were used in those ancient days, and that was how the surgery was performed upon a patient. People had rhinoplasty. First plastic surgery practices were there. Sushruta, the father of surgery, was considered to be the first surgeon who existed in the world. And they are all the instruments. Even for today also, we use the same kind of surgical instruments. Next, please. You can see the doctor is performing cataract upon a particular patient. The uppermost, the left one is rhinoplasty. Next, please. So basically, when you get into the principles of Ayurveda believes that a person who has to be healthy should have a healthy doshas. Doshas means a governing things in a body. That is Vata, Pitta and Kapha. These are the three humors which governs our health. As long as they are in equilibrium, probably everybody is healthy. That is what we say. Who is healthy? Samadoshaha. That means all the doshas in Samavastha. Samagnischa. That means is Agni. Basically digestive power is normal. Samadosha, Samadhatu, Samagnischa, Malakriyah. See, all excretory organs, excretory things which need to be excreted are to be normal. And all the dhatus, that is, the healthy tissues which make our body are to be normal. Then only we call it as health. That also includes spiritual and mental health. The same as the WHO also gives us. Next, please. So these are the doshas. Next, we go a little faster. These are the dhatus. Dhatus means, automatically rasa, rakta, mamsa, medo, asti, majja, shukram. Rasa means the basic part of the first dhatu, which is developed into raktam, and then into rasa, rakta, dhat, mamsa, asti, majja, shukram, and medas, shukram. Okay, these are the 7 dhatus which makes our body. Next, please. The Prakriti, depending on all these dhatus, when we look at it, everybody has got their own unique constitution. That is Prakriti. According to their Prakriti, they are advised, or they have to incorporate the dietary things in their diet. So according to the seasonal things, seasonal changes, they have to make some differences according to their own Prakriti. And Agni is most important thing, which is very much required. Whenever you eat something, that has to be metabolized. This is not the basic metabolic thing which digestive power, Jఠar Agni, what we call. Every meal which we eat, it has to get digested, and it has to be converted into the energy, and rest of the Kitta Bhagam, that is, excreta, which has to be excreted in a very proper way. Then definitely the health restored. Otherwise, there will be a disease. Ayurveda basically what it does says is, as long as you're healthy, it has to be sustained. Whenever there is a disease, Ayurveda tells you the cure. Not the management, but cure. Most of the diseases can be cured. When it is cannot be cured, then we have to manage it. If not so, then definitely we call it as asadhyam. That is the prognostic values. When we grade it in such a way, sadhyam, krichra sadhyam, yapyam and asadhyam. Okay? Next, please. Next, please. So to maintain all our healthy life, healthy things, we need to follow the dinacharya. Dinacharya means daily routine. When exactly we have to get up? When do we have to get up? So usually our ancestors says, our elders says, we need to get up at 4:30. That is Brahmi Muhurta, which is 1 hour 30 minutes, 1.5 hours before sunrise. Why exactly that? if no one really gets up in the morning, because of their maybe lifestyle, maybe job, somebody goes to bed maybe in the mid of the night, early morning of the night because of their shifts. Basically what really happens is at 4:30 when somebody get up, that particular time our basic metabolic hormones like thyroxine and all of the catecholamines, that is adrenal, are very low. So automatically your metabolic rate is completely zero, normal. Then if you get up, your excitement, your anger, everything is normal. So then if you start your day, that will become very easy for you to maintain all the day. It becomes completely at peak by 9 o'clock in the morning. So if you get up in the 4:30 in the morning, then automatically your day starts with a very healthy note. So these are the routine things in which we need to do. First, getting up in the early in the morning and then doing all your natural calls, attending natural calls. Your oral care is very important, including strapping the tongue and all. And then doing, some abhyangam onto your body, doing some exercise. See, abhyangam nowadays no one is doing. Have you noticed all these days, whenever we go for a blood checkup, we'll see our vitamin D is very low. Am I right or not? Because most of the times we sit under a roof, this particular roof. No ventilation, only air condition. We never get exposed to any sunlight. So automatically all our vitamin D is very low. Basically vitamin D is a fat soluble vitamin. So our ancestors used to do a lot of abhyangam onto their body, anointing some oil onto their body and sitting under the sun, exposing to the sun. So basically sun is the best source for vitamin D, where your skin is metabolized, vitamin D is metabolized in the skin and then that is supplied. Now automatically even when your vitamin D is very low, if you start anointing some oil onto your body and sit in the sun, probably within 15 days your vitamin D comes to normal. So such a wonderful thing. So those practices are gone now. Sorry. See, it has to be. See, sunlight is more healthier when it is orange in color. As it goes little brighter, it becomes a kind of a burning. You might burn your skin. So oral care.
These days, the doctors are saying more exposure to sunlight can cause skin cancer.
That's true, sir. See, I'll tell you, sunlight when it is after maybe 7:30, it becomes more brighter. When it is little orange in color, the frequency is very less. Ultraviolet frequency is also less. So automatically you will get more the vitamin D during that particular period. If the brightness goes up, automatically your skin also starts burning. Have you seen people, those who are polar areas, living in the polar areas, they go for sun bath only because to get the sunlight or vitamin D. Those people, because they are not getting exposed to the sunlight, they are getting skin cancers.
My question was, what time to what time in the morning is good?
That is what, sir. I am very specifically saying orange color sun. Arunima is there. Can you imagine Arunima? The red color which comes out before the sunrise, and the same in the sunset also. That should be the ideal light. Even for those newborn babies, those who become a little jaundice type of things, they are advised to expose to the sunlight.
Friend, I understand that all of us will be having a lot of questions. So my only suggestion, request, let us reserve our questions.
That would be fine actually.
At the time doctor completes, then we'll have enough time with him. Thank you.
Soil massage, doing some yoga. After doing the yoga, you need to have a bath every day. After that, according to your own practices, that is meditation and all, according to your own practices, you can perform that. Next, please. Ayurveda always advises to have 2 meals, one in the morning and one in the evening. Yeah. So that could be maybe nowadays we are having a breakfast, lunch, and dinner. That's true. According to Ayurveda, what really happens is, whenever you have a full meal, that is in the morning, you can have full meal according to the season, as per your constitution of the body. So you can incorporate things into your diet. You can have it. Then you can go to your work and do everything, come back home, and you have to finish your dinner before sunset. After your dinner is finished, you have to go to bed and aim for at least 7 to 8 hours sleep. The moment it reaches your bed, by the time you have a sleep, your dinner must have already digested. That would be the healthy practice. But it doesn't happen all the time. So everybody should exercise these kind of practices, then automatically the longevity definitely is always with you. Then coming to Rutucharya. As we have seen, Dinacharya, that is a daily routine which has to be practiced every day. And Rutucharya, it all depends upon the season. See, all the 6 seasons we have, right? Everybody aware, right? 6 seasons. So, yeah, that particular book we have made it, that one. You can go through that. Yes. Everybody got this? So in these seasonals, according to the season, you have to practice your diet. In a particular season, very hot things are required to be incorporated into diet. Sometimes spicy matter is not recommended in those days. So according to them, you can really have them. Next, please. Next, please. Though we suggest Rutucharya, Dinacharya and everything, but you can adopt according to your own dosha, your constitution, by consulting a good Ayurvedic doctor who can tell you your constitution, and according to that you can practice your diet, individual customized diet. Ayurveda always tells us, it looks at a person as a whole. Unlike any other system of medicines, we always look as a whole: mind, body, and spirit. So we treat accordingly. Whenever we are trying to treat the body, we also consider the mind. We also consider the spirit. We also take consideration of the season of that particular time, and then we start giving a personalized prescription. Next, please. Next, please. So this is an Ayurveda ancient system of medicine for the modern times. Next, please. When COVID has inducted into our lives, it has left a lot of experiences. Actually, we lost or forgot all the practices those used to be have in those older days. In older days, everybody used to be called as an orthodox. But nowadays, those practices are the modern practices. So Ayurveda, it tells you preventive care. Basically, it tells us the preventive care. Ayurveda is the only system which talks about the prevention. Next, please. There are many slides, but we'll go very practically. Probably that might bore you. The basic 3, the pillars of the life or health is Aharam, Nidra and Brahmacharyam. Your food has to be very healthy. It has to be, very healthy, energetic and, life-saving. So we were talking about, according to the season, you need to have a good prescription or good amount of ingredients in your life, the diet, according to your condition, your doshas, according to your season. So you have to adopt your diet. Then nidra is, complete healthy sleep. Sleep is not the one which has to happen in the day. It has to happen during the night. Nowadays, what exactly the people think is, see, throughout the night I'm working, so I have to substantiate sleeping in the day. But that always brings some disease to you. Because I'll tell you, during the night what really happens is metabolic rate is very low. In the body, metabolic rate is very low. When we sleep, our cortical activities also becomes very low. So that will match. Automatically metabolic activities are very low. That will definitely nothing to harm. But when you sleep during the day is very active, your cortical activity is completely low. Automatically there will be a problem. That fellow definitely get into vata disorders. That is some of them neurological disorders, maybe metabolic disorders all the time. Only Grishma Ritu is allowed to have Divaswapnam, that is sleep in the day, that is during the summer, but not in winter, not in the rainy season. Next please. So Brahmacharya means procreative activities. These procreative activities also be in normal sense.
Sir, in Andhra, sir, what happens is afternoon times everyone sleeps.
I will come up, sir, please. I'm sorry. Otherwise, it starts deviating. See, reserve all your doubts, whatever, we'll definitely have, maybe I'll stay up to whatever the time you want. But bring out all your doubts. So, this is the holistic approach, whole body wellness. We look at everything in the body. When we are treating a particular condition in a particular area, we also look at, other areas in the body. So, we'll start treating the whole body, then everything comes into normal. Next, please. Next. 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 So this particular thing is very much required. Now as most of the people were talking about allopathic system and Ayurveda. There is always need of integration. Every immediate situation, acute conditions, they require allopathic treatment modalities. When it comes to a chronic kind of condition, automatically Ayurveda can definitely heal the situation. For example, status asthmaticus, that is, the bronchial asthma, when it comes in a very acute state, he requires some oxygen or some steroid supply. Steroid support, some oxygen support, some other antihistamine support, which can be adopted from the modern medicine. After that, whatever the situational changes or systematic changes which are required to be adopted into the body can be managed with Ayurveda. So finally, if Ayurveda and allopathy can be incorporated or integrated in that particular patient, automatically everything can be managed. We can really help the patient. And Ayurveda and naturopathy, of course, they are both they go together. Next, please. And we'll be definitely discussing about accessible remedies, simple solutions for daily life. These are two success stories. This first thing, pass in. Yes, pass it. I have to tell you something like this. Get back. There is pass button. It's a video. पॉइंटर वहाँ पे लेके जाओ. हाँ, वहाँ पे है ना. This particular girl who had a birth injury during the delivery, she had some problem. It was an assisted labor. So she had a problem and she had, anesthesia in this particular area, this particular left lung. It was completely anesthetized. There was no sensation in this. So at the age of 3 months, she lost her mother. Then she started, thumb sucking. In the beginning, it was almost all normal. When she started teething up, she started biting it. Because there was no pain, she continuously, biting. So that happened almost at the age of, at the birth age. I saw that patient. The patient came to me at the age of 8 years. So all these years, that was like that. That was the situation. Switch on. So it got treated in almost 1.5 months, sorry. It was completely normal. And the best thing was, she gained her sensation also. It all because of the Vidya Karma which I did. And she's the girl, and I'm really sorry that particular video was lost. Okay, not a problem. So there are many things, which can really treat with these particular things, Ayurveda. It was auto amputation, madam. Auto amputation. She started biting it since, there was no pain. And there was, something she could enjoy. Because she lost her mother. The feeding, everything was little from outside only, outsourcing completely. So somehow she was managed by her paternal grandmother. So she brought to me. And irony was, she was about to be amputated up to this particular area. We could stop it. Now the girl is with the same thing. If you want to see, I can show you in my mobile.
Did it grow back? No.
No, sir. Can you see this? Yes. Yeah, this was the first one. It was in 12th Jan 2021. Okay. It was after 7 days. This particular picture. Can you see this? It was up to 20 days. And that's something different, madam. I'll definitely answer it. Definitely. And this is up to 20 days. This was 1 month with 10 days. It's maybe 1 week. And this was the girl. Can you see this? This was the girl. It all happened, in 2021. So we could at least treat her. There were many cases which, I only had, few amount of pictures of which I could, exhibit in front of you. Next, please. Now we'll come to the kitchen. What really need to have in a kitchen where you can at least, treat some of the minor elements. And most of the times we are not, I'm really against to tell you all the remedies because most people start doing the remedy at home and leading it to some serious conditions. My sincere advice is not to do that. Whenever you have any simple minor element, try to do this. If not so, see the doctor. Okay. I will definitely give you some of the main things which I can really advise you. These are the basic things which you can have from among the spices. You can have turmeric, cumin seeds, coriander, fennel. I'll tell you, turmeric is a very essential thing, but everybody has to ensure it is very organic. Nowadays people are buying it from outside where it is, adulterated. Lead oxide is the most very prominent condition where, prominent substance which can be adulterated with that, because that also looks almost like haldi. And this particular haldi can be directly applied onto the face. Most of our females, our mothers or sisters at home, they apply it onto their feet during some ceremonies, right? Sometimes it is also allergic to some females. So whenever you try to do it upon your face, trying upon your body, try to do a patch test, then try to apply it. But ensure it should be organic. It should be powdered by your own things, like, okay. Then this particular haldi can be had every day in the morning and evening in a cup of milk. So you can stay away from your allergies, stay away from your coughs, regular coughs, or seasonal changes, or seasonal upper respiratory tract infections also. Cumin seeds, jeera, cumin seeds of jeera, which are also very important in our diet. But it has to be always used after roasting. Jeera is considered to be a poison if it is not roasted and used. So it has to be roasted and then used. Everybody, they put in a saute and then they use it, right? So automatically it is purified. Fennel is also same. Jeera is used in most of the urinary tract infections. Along with coriander, you can use it. The jeera, if it is taken with jaggery, the Puran good bolte na, old jaggery, which is more than 6 months old, which contains a lot of iron, other trace elements. Black color one, black one.
Brown.
It could be anything, sir. I'll tell you.
Light dark. Black is for animals. Brown is, we have charging medicines. Brown is for the people.
Could be, sir. I don't exactly know that, because Guda is our term which we use it. Most of them we advise, but we don't buy it and give it.
Good.
Yeah, good. Good is good actually. So if it is made to a paste, jeera ka gudam, that is Sanskrit, classical medicine, jeera ka gudam, which has to be made, repeatedly, which has to be, done in the mortar continuously for maybe some 100 times or 1,000 times. It can be taken regularly, which is an anti-helminthic. That means it combats the intestinal worms. It is good as a carminative, very good in carminative. If you have any bloating condition, like continuously bloating, if you can take jeera ka gudam, that is wonderful. Madam, take jeera, which is roasted, and then put it in a kalvam, that is in a mortar. Then take a pestle, take the gudam, which is more than 6 months old. Continuously you would rub it, make a paste of it. When it gets equated continuously, it made a very good paste, and then make a tablet of almost regupandu, that this much. Then you can have it continuously. See, madam, jeera, we are from, since birth, we are still using it. Then what is wrong taking it continuously? See, when it comes to the medicine, we always talk about, the duration. According to the Ayurveda, most of your foods are medicine only. Food, since we are taking in a larger quantity, we call it as food. Medicine, we take it in a very little quantity, so we call it as medicine only. So automatically the same with the duration also. Food you can continuously take till your death, but medicine, it can be anything. Madam, I'll tell you one thing. If a particular powder, I'll tell you, Hingvastaka Churnam, that is there. If your appetite is low, your appetite is very bad, then you need to put 1 spoon or maybe 2 spoons into the first bolus of your rice, and put a 1 spoon of ghee into it, mix it, and you just have it. The first meal of your bolus, first bolus of your meal, right? Then that definitely helps your appetizer. Very good appetite. It increases all your appetite. If you take in mid of your meal, it takes away all your bloating condition. Whenever you bloats, it bloats, no? Automatically it goes off. If it is taken after the meal, it takes off the diarrhea condition and takes off, other digestive issues. This is how we plan it. Ayurveda tells you the dosage like, mohur. You can take, multiple doses. Before food, middle of the meal, after the meal. So that's how it is divided. So coming to coriander is a wonderful thing. Even it's used as leaves regularly in our curries and all. It is also used as a dry seeds, which can be made into paste, or it can maybe made into the powder and can be used. If somebody has any urinary tract infection, regular burning in micturition condition, if you can consider it as a minor element for a shorter period, during the night, before going to bed, you take a powder of 1 spoon of full of powder, these coriander seeds, 1 glass of water you made into boil. During the boiling, you just put 1 spoon of coriander powder, close it and close the stove. Next day morning, you take entire water. That is called dhanyaka himam. If you can practice continuously, chronic urinary tract infections also goes out. It's a wonderful medicine. It is a pure urine alkalizer. It also works in prostatic condition. In most of the prostatic conditions, what we see in senior males, after 60 years, whoever have any prostatic condition, prostatic ailments, if there is any emergency, urgency, if they can practice this, automatically it is, subsides a little.
Sir, what is the coriander in Telugu?
Dhanyalu. Yeah, Kotmir. I'm talking about the seeds. And taking a paste of, 1 bunch of coriander leaves every day in the morning with 2 black pepper seeds. Black pepper needed to be roasted ones. 2 black pepper seeds, 1 bunch of coriander leaf paste made into a bolus can add. That will improve anemic conditions, most of the anemic conditions. They can really have. We have observed, madam, in conditions, after 1 month, we could see almost 1.5 grams of raise in hemoglobin.
Even with the amchur we have tried. Amchur, what is that?
We'll come into it. Amchur, I don't think. Amchur means mango powder, right? Mango powder. Coincidentally, it must have happened, but I don't think. That is purely amlathum. Amlathum, that is.
Moringa leaf.
I'm coming to that actually. Moringa leaf is wonderful actually. Moringa leaf, nowadays people are, buying it large. This much of capsule is costing us around 7 rupees. Which is not even cost of almost 1 paise.
Sir, sorry, my friend has been saying not to put many questions. Last time, when I went to a shop in the US, Costco, 100 grams of moringa leaf was sold at $10.
That's true, sir. That's what I'm saying. If you can grow your moringa plant at your home, so everything will be free for you, right? So coming to fennel seeds, there's a practice that, after every meal we chew fennel, right? Somp. That, helps in your bloating, that helps in your digestion, that helps you in your cardiac issues. it can be roasted or it can be directly taken. But roasted fennel seeds taste a little better. Not required. Next, please. There's the few things which you can have it in your kitchen. The first thing is tulsi. Of course, everybody have it. Tulsi is a wonderful thing. It's a basil, holy basil. In that we have many things. Krishna tulsi is almost 64 varieties of tulsi are available. So this is Lakshmi tulsi, which you are seeing now. Krishna tulsi is a little darker, black kind of leaf, brown kind of thing. There are many things. Sometimes where tulsi things are taken from some other species, which is more concentrated. They make into crystals, which are used into some of the spices. Rama tulsi. Yeah, of course. You can make a little boy as little as 1 month can be made to eat. See, whenever there is any upper respiratory tract infections in most of the children, when we prescribe a medicine, we ask them to take anupanam as the tulsi only. Tulsi rasam, the fresh juice, fresh leaf juice, that can be taken 2 to 3 drops, and then the medicine is put into it, and then it has to be chewed. And then ashwagandha, which is a very adaptogenic. Some of the patients were asking me, ashwagandha, how exactly it can be used. Ashwagandha is more like, it's a brahmanam, it is vajikaranam, it is more potent. But it is seen, according to some of the researchers, according to chemists, it's the vidhanin, vidhaniol, all the ingredients which the ashwagandha has, are shown very good effect in as an anti-inflammatory. So it is good in the joint pains or any painful conditions, inflammatory conditions. It is a very good immunogogue. It improves immunity. So it is best in most of the autoimmune disorders, like rheumatism, like psoriasis, like in any other autoimmune disorders. Okay. We'll come to that. Please pull out your question maybe in the next. You reserve it for. Don't forget. And next, Triphala. It's a most common name, which is known by everyone, wherein these 3 fruits are there. One is Abhaya, that is Haritaki, Harada bolte hain. Karakai, Terminalia chebula. Rendodi Abhaya, that is Tanikaya. Terminalia bellerica, Latin name. The third one is Emblica officinalis, that is Amla, Usirikai. Karakaya, Tanikaya and Usirikaya. And that is, a Terminalia bellerica. That is, 3 myrobalans. People call it as 3 myrobalans. They are wonderful drugs actually, which is used in every disease, but even ratios. Triphala is the most common thing. It also used in obesity, maintaining obesity. It is also used in eye disorders. It is also used in anemic conditions. It is also used as laxative. It is also used as many other conditions. There are almost 108 types of combinations which can be made with Triphala. 1:2:3, 1:2:4, 1:4:8 kind of things, which can be made into this. Then automatically that particular medicine is prepared. If it is equally equated or powder of equally made, then that can be used as a laxative. At the same time, it can be used as any other conditions like obesity, maintaining obesity. But for obesity, it can be 1:2:3. Amla has to be 3 parts. Balarika, that is Abhaya, is has to be 2 parts. Haritaki is 1 part. Triphala is 3 fruits. 3 phala. Triphala. Beda and Amla.
Only put, ఉసిరికాయ కారంలో పెట్టి ఉంచుతారు, స్టాక్ చేస్తారు, అది తినడానికి బాగుంటుంది, అది మంచిదా కదా?
చెప్తాను. Sir, I'll tell you the importance of Triphala is very much, sir. Here the Haritaki as alone can be used as laxative because it has got a lot of tannins in it. It can be used as laxative. If you consume 1 spoonful of harda in the night in a lukewarm water, 1 glass full of lukewarm water, next day the motion will be, the bowels can be very free. All the 3 fruits which we are discussing now has 5 rasas, pancharasatmaka alte hain isko, except lavana rasam. They do not have a salty taste, but rest of all the things, katu, madhura, amla, katu, tikta and kashayam. All these 5 tastes are available in all the 3 phalas except lavana rasam. So that is also very important thing in this Triphala Churnam. If somebody has any sore throat is paining, you can take 1 spoonful of Triphala Churnam, put into 1 glass of water and start boiling it till it becomes half of it, and then take it off. When it is lukewarm, you start gargling it. You do it every 2nd hour. I think within 2 or 3 episodes, your sore throat gets completely normal. Your throat pain also goes normal. In chronic wound situations, whenever there is any diabetic foods or any other foods, before doing some bandage or dressing or so, instead of saline or betadine, if you can make a kashayam out of Triphala Churnam, if you can wash it with that Triphala Churnam, that even works more better than betadine. So one more thing, which you need to have at your compulsorily in your kitchen is ghee. Always, according to Ayurveda, whenever we say ghee, it has to be cow ghee, not the buffalo ghee. So ghee here, how exactly we make ghee? There are 2 ways making in ghee. One is, taking cream out of pasteurized milk. Second thing is, every day we take up that particular cream out of that particular milk and then store it for a few days and then churn it, make a butter out of it and then boil it to have a ghee. Right? The second one is more preferable than the first one. More polyunsaturated oils, whatever you require, the cow ghee, that is there. Cow ghee also has vitamin D, because vitamin D, E, K, A, D, E, K are fat soluble vitamins. All these fat soluble vitamins are available in cow ghee, which are very much essential for our daily routine. When you have ghee, you will also get vitamin A, D, E and K. Very wonderful. If you continuously feed your baby, your newborns till they're adult, become adult, if you can feed them with ghee, they'll have very good intellect. Because every brain requires, some amount of lipids. So it's a Medhya Rasayanam. Medhya means intellect. Rasayanam means improving, becoming very healthy. Whatever the substance which makes your mental abilities more powerful, that is called Medhyam. Here it is Medhya Rasayanam. there are plenty of Medhyara Senas, like, as we have seen, St. Madhu. So ghee is also Medhyara Senam. Everybody can have ghee regularly. That will improve your intellect.
Sir, ghee was a fatness or something. I have stopped taking ghee from 1980. So you want me to take cow ghee?
So I'll just come to it, sir. Please remind me once it comes, because Madam, I'll tell you in a very scientific way how exactly it has to be taken and what would be the situations, what would be the sequelae after taking the ghee, right?
Does it not increase cholesterol?
We'll definitely come to it, sir. See, as personal, because both of you are asking it, just let me clarify it here only. One of my two patients, one is has come with triglycerides of almost 456, which has to be only 150, below 150. The other person has come with 260 or 270 somewhere. So I asked them to use Guguldiktha Ghritam, which is a particular Samskarita Ghritam, which is a medicated ghee. Within 1.5 months, they have come into almost normal. It could have been raised had it been like, if it increases cholesterol or triglycerides. No, it didn't happen. Really, sir, you can really try it. But it doesn't happen with the buffalo ghee. And everything, and the second thing is, as I told you, that particular cow ghee has to be made in that particular process which I told you, that it has to be boiled every day, and then take some cream out of it, and then take butter out of it, and then boil it, then you'll get a cow ghee. That Samskarita Ghritam is always better, which will not increase your triglycerides. And nuts here, almonds are very important, sunflower seeds are also very important. These two things will have, omega-3 fatty acids, which are very important for your healthy cholesterols. Okay, almonds are also good. And I am not telling you the kaju, but here almonds. You can include your akhroot, walnuts. That is also very important. Next, please. Of course, whole grains. These are all everything for your kitchen. Next, please. Legumes, of course, you should have. Next. The healthy oil is sesame oil, and then coconut oil. Now, everybody nowadays talking about, keto. Olive oil, I don't suggest, that is very suitable for Indians, because Ayurveda always says about samsthanikam, because whatever is available around you, which can be grown around you, which can be available around you, which can be produced around you, has to be taken. Because you will only be staple to that particular season or to that particular product, then only you can have. Since we are in southern India, we are not adapted to what is that, rai ka tel, sarson ka tel, right? Here, this particular climatic condition, North India, they are susceptible for it.
They use
But
even in curries and all.
that's sir, right, sir. I'll tell you. See, whenever see, what people say is सरसों का तेल बहुत गर्मी होता है. हाँ.
It's hot. They say
It's hot only. Because sarshapa, we call sarshapa is, that's particular rye. Sarshapa, we call it as rice. In Sanskrit, we call it as sarshapa. Sarshapa is tikshnam, katurasam, and ushnaviryam. It is good hardness in it. So that is what. See, गेहूं का आटा कहाँ पे यूज होता है ज़्यादा? यहाँ पे राइस होता है. So the staple food is where you can grow a lot of things which are available here, that is becomes stable. Olive oil goes mostly in Bolivia and Europe, those countries. That is more adaptable to those people, but not here. Nowadays people, started taking it, but I don't see any very advantage out of it. And this particular, please go back. Sesame oil, that is sarson ka tel, sorry, til ka tel, gingerly oil, which is very useful. All our oils, medicated oils which we make in Ayurveda are made out of til ka tel. Tailam comes from til. Taila means, oil means til ka tel. You know how exactly it can be used, in what kind of conditions it can be used? Pardon, ma'am?
Masala, chili is a masala we make with biryani.
Hmm.
That also we can use sesame oil.
No, sesame oil as an edible oil you can use it anywhere. I am talking about the medicinal value of til ka tel. Huh? Wherever you want, you see the dryness in the body, you can apply the sesame oil. If it is dry,
From ginger oil,
gingerly oil, sesame oil, nuvola nune, til ka tel, everything is same, sir. The only difference is some of the til tel is made out of white sesame, black sesame. Black sesame is more good. And Thailam is completely against Vatam. Whenever you feel that there is a Vata condition, some neurological condition, Thaila is the best thing. To maintain your health regularly, not to have your knee joint pains or so early, you start practicing til tel intake. Every day if you can take 10 ml of til tel regularly intake, I am talking about intake, then your joint pains will be postponed by maybe 10-20 years. That is true. But there, let me. You can think of prolonging the life, sir. He may live up to 1 or 5 years. So tilka tel.
already you have joint pains, then also
Yeah, definitely, sir. Every day. But you need to have an anupanam. Anupanam, which has to be taken along with. That should be mand bolte na, mand. Chawal ka pani nahi, after cooking, whichever you take off. Pinch, whatever. Ganji. Right. Or, that ragi malt also you can have it. It goes with the same. Yeah, of course you can. Before the breakfast. But once you take along with oil, I don't think you'll have it again. You don't wish to have it in life. Because one has to adopt the taste of til oil. And whenever you try to use the til oil, you try to boil it for the first time. Little boiling, and then you keep it aside and then start using it. That would be better. Even for medical application, like as you want to have hair healthier all the days, just start putting that little oil, that particular boiled one, every day in the morning. You apply into your nostrils regularly. You'll see that the hair becoming very healthy even after just third day. And you'll be away from having all the dust allergies. Sinusitis, and those kind of regular, seasonal cold and all, that'll be completely away. Yeah, of course you can. That is called nasyam. Pardon me? There are many practices, which are very practices. Sometimes, somebody's own conceptions. And
Sir, can we have all the questions later on?
okay.
Program will be delayed.
So again, coconut oil is also very good. That is also having very good these things. They're all free of trans fats. Polyunsaturated fats are very much available, which are very good for your health. The next, please. Teas and infusions. Whenever you want to have some tea, you can have CCF tea, cumin seed, coriander, and fennel seeds. Mix together. Put some basil leaves or maybe some little ginger into it. Have some rock salt into it, and then you can have it. That is a wonderful tea which you can have during your breaks. You can really relax yourself while you have it. Of course, ginger tea, of course, everybody knows it. Next, please. And this is the fresh foods, everybody should have it their home. Next, please. When it comes to the dairy products, all we had, we discussed about ghee and other these things, cow milk, butter, whatever you want to, you can. Sweetness, of course, raw honey and jaggery. Honey, if you can get, the pure honey, every day, if you can apply it onto your, the eye regularly as kajal, what we do. That is a wonderful chakshusham. That is, that improves your eye health. Sir? Of course. Kajal. Inside the eyelid, the lower eyelid, is that right? This is inner canthus, this is outer canthus. Just start putting like this. Just, close your eyes for at least 2 to 3 minutes and wipe it off with cold water, not warm water. Ice never be, applied to the warmth because it is, the seat of pitta. So it should not be given hot water. That's the reason why, you should not put hot water directly onto your head. When you have head bath, you are supposed to have with the water, with the heat of your body temperature, but not more hot. If you continuously have a head bath with your hot water, more of hot water, your eyesight becomes very weak. That is true. And sweeteners, of course, jaggery. And honey is called as yogavahi. Whenever you consume a medicine, if that particular medicine is mixed with the honey, and honey takes qualities of that particular medicine and acts as a medicine itself. That's called yogavahi. If you are giving a medicine which has to alleviate vata, honey becomes anti-vata. It has to alleviate pitta, it becomes anti-pitta. If it has to alleviate kapha, then it will act as anti-kapha. As alone, it is anti-kapha. When you have cough, regular expectoration, regularly if you have honey, if you chew honey regularly, the cough will go off.
Is it okay for diabetes people?
Sir, it's purely fructose. There is a difference between sucrose and fructose. What regularly we have sugar, that is sucrose. Honey is a fructose. Fructose is little different from getting metabolized. So your glycemic index would not change, I think, but not much this thing. That is always required. See, even when you are taking, a bowl full of rice, it is almost equivalent to 2 spoons of honey. If you can compare substantially with that, same thing, nothing will happen. If you are required to have 800 kilocalories a day, you can calculate accordingly. You can incorporate your diet according to your, regular things with calculated amount of diet.
That's honey cures gangrene.
Yes, sir. Yes, sir. See, of course, honey contains a lot of what you call pollen, which we call it as bee pollen. It's a very good what you call vranaropakam, vranashodakam. See, Ayurveda only has a thing called vranaropanam and vranashodhanam. Whenever there is a wound, it needs to be corrected from inside. It has to be treated from inside. And there should be, improvement in the callus formation. Then only the wound becomes normal. So both these activities are there in honey. So it is Vanarodopam only. Yes. I'll tell you, sir, in the olden days, whenever there was, lacerated wound, that is a cut wound, do you know how they used to stitch it? Suturing. No. Do you know ants? Ants, big ants. They used to approximate the skin. They used to apply the ant used to bite it, and then their head is cut. That stays back. That head stays back. And they start applying the honey on it. Honey, this head of the ant will act as a suture. Since it is pure calcium, it gets completely absorbed into the skin. Later on, we are applying the honey onto it. That acts as a healing agent. Poisons, see, ants are not poisonous. It will only have a particular acid called pipric acid. Pipric acid is a substance where, that leaves as along, it passes through. And the next ant which comes, behind it, that takes that pipric acid as the agent, it follows it. And that is not a poisonous one. Pipric acid is very weak acid actually. We'll come to it, sir. Please. So now we are talking about, the 5 foods, superfoods which you should have. One is first, it's an amla. Go please. Amla is, as we have already taught, today I'll give you 2-3 recipes. Amla can be made into murabba, a sweet murabba which is very tasty. Children will love to have it every day. If you can really give them, every day after their meal, maybe breakfast or maybe lunch, that checks all the digestive issues. At the same time, amla is a rasayana which slows down the aging process. Your aging will be delayed by some more days, some more years, I can say. So as I told you, it is pancharasatmaka, except lavana, all the 5 rasas are there. It checks out all your healthy things. If you take regular amla intake, you will become completely healthy. And of course, it is an exaggeration, but our Shastra says you can live up to 1,000 years. It's true, that's true.
So everybody should start taking amla every day.
Life becomes bore. Eh? So if the particular amla,
We can serve people more days.
this particular Kartika Masam, we get plenty of amla. Fully ripe and amla, you just bring them. I'm coming to that. You take amla, buy them, and then you cook it for semi-cooking, 80% cooked, 70% maybe. You take all the cloves, that seed, you can take it off, put all together, and then take jeera, buneva jeera, powder of buneva jeera, roasted jeera, roasted ajwain. Take some kala namak, black salt. Powder everything and start mixing it and everything, and try to dry it in the shadow. It should dry and becomes completely dry. It becomes very tasty. As soon as you complete your meals, at every time, you can have one particular one. That is sufficient vitamin C, which will be, for your entire day. It gives you a very good amount of vitamin C.
So what about the other type of amla? ఇది పెద్ద ఉసిరికాయ, చిన్న ఉసిరికాయలు ఉంటాయి.
దానికి ఏం మెడిసినల్ ప్రాపర్టీస్? That is paithajanakam, pittajanani. Tasty, but it leaves acidity in your stomach.
So we should use bigger one.
Which is, and this one, which is seen here, this is one. Emblica officinale.